shall now go on to our last speaker, Dr. Ankit Agarwal, who is again is a phaco-refractive surgeon and has immense awards and credits to his name. And he is going to be showing us again a case of an intumescent cataract and how he managed it, a little different. And there is a learning tip there for us before we close for the day.
Am I audible, ma'am?
Yes, yes.
Hi, Ankit.
Yeah, first of all, hello, sir. Good evening.
Hello.
First of all, I would like to thank Chitra ma'am and AIS ARC for giving a young surgeon like me an opportunity to present.
By the way, he's from Prayagraj. Yes, I should have said that in the beginning. I actually started telling something else. Tell me.
The topic is intumescent rhexis made easy. My technique which I use is the double rhexis method, in which first I do a small rhexis in the center and then I extend, as discussed already during the R.K. Sharma's case by Chitra ma'am. Now, during the COVID season, for 1 or 2 years approximately, patients were very afraid to come to the hospitals. And post-COVID, there was a glut of patients with hypermature and intumescent cataracts. Now, this was the case which we operated, and as soon as I put a nick in the AC, suddenly this happened. Now, for a young surgeon like me, it was a very challenging thing. So soon I realized that I need to make a rhexis perfect because I'm not a VR surgeon. I cannot handle any of this drop myself. So first, in the AC, I put a very high viscosity viscoelastic. The one I prefer is a 3% sodium hyaluronate. Now, by making a small rhexis and using IA to debulk the nucleus, then I can increase the rhexis using a microhexis forceps. This gives me optimum control, and a rhexis of approximately 5.5 to 6 mm can be achieved without any problems. This is another case in which, similar case in which I have done this. 3% sodium hyaluronate solution is used in the AC, and a small rhexis is made in the beginning using first the nick is made in system, a culvinear made as already discussed before, and a small rhexis using microhexis forceps. Then, using IA, some amount of debulking is done so that the interlenticular pressure is less. This will reduce the incidence of radial tearing. Then again, the AC is filled with high viscosity viscoelastic, and the rhexis can be extended. This is the third case, a similar case, but in this, the cortex is not at all milky and there is no fluid egress. This kind of hypermature cataracts are very dangerous because since the cortex is not milky, automatic debulking of the nucleus is not present. And this kind of cataracts can result in a lot of rhexis runout cases. Similarly, debulking is done. You can see that debulking can be seen using IA. What I do is I press the nucleus a little bit and rotate it in the bag. This will reduce the cortical matter behind the nucleus also, and thus it is completely pressed to the posterior capsule. Now rhexis is extended using a microhexis forceps. Now, in spite of all these efforts, sometimes the case may run out. And in this case, due to not having microhexis forceps, I was using Haldi Poker's rhexis forceps. Trying to make a small rhexis in the beginning, but as you can see, because I don't have a microhexis forceps, some amount of viscoelastic is leaking out from the port, and this resulted in the rhexis kept running out, and I was not able to salvage it in the beginning. To reduce the interventricular pressure on this side, I make a small cut on the opposite side. Thus, it will prevent running out of the rhexis from the side of the runout. Now, I have to make the rhexis as round as possible. So a small nick here and making it round. By this time, my assistant brought me the micro-access faucets. And I could now make something similar to like a Rexis, but with two runouts. In this case, I have to bring the nucleus in the AC and complete the case, just like Dr. R.K. Sharma.
Dr. Ankit, that was a truly wonderful video which you showed. The consistent, really needs a clap. Consistent, nice round rexes and doing multi-quadrant IA so that you're totally debulking the soft cortex out and then going on to extending your rexes to a beautiful, each video after the other was a teaching video. And the last thing which you showed was also an excellent learning tip is the making an extra nick, because that would prevent the wraparound rexes tear happening, and how you convert it into what near normal round and completed it. I do not have any questions. I just wanted to extol what you did so well. Mohan Rajan, Dr. Malay, Dr.
Ankit, I think Chitra, you reserve the best for the last.
Yeah.
Ankit, beautiful videos.
Yes.
What is important is, I think you have done the small rexes, but after the small rexes, this is what I'm trying to tell everybody, that please understand that when you do an irrigation aspiration, it is not only the front compartment, but also the back compartment. The back compartment also has to be decompressed. The back compartment that's why you are rotating the nucleus, and the fluid from behind the nucleus is also coming off.
Yes.
Okay. So that also prevents the Argentina flag sign. Wonderfully done. Lovely videos. Really kudos to you.
Yeah.
Thank you, sir. Thank you so much.
In fact, I think it has been any other comment from anybody else before we conclude? I think we all need to.
I want to make one comment, Chitra.
Yes.
Friends, I hope all of you will agree that you cannot have a more energetic chairman ARC than what Dr. Chitra is.
Clap, sir.
Yeah. We should all give a standing ovation for her.
Yes.
The simple reason is, you can do 1 or 2 webinars, 5 or 10 webinars, but doing continuously on a sustained basis, and each and every webinar is successfully hitting the top is something which is really, I know how much of hard work and effort she has taken. So seriously, hats off to you, Chitra.
Yes.
I'm truly amazed by your energy levels, your dedication, your enthusiasm, and your commitment to ophthalmology and teaching, which is again very, very important for all of us. Your passion for everything. Hats off to you.
All the ARC members are seconding you.
Yes. True.
Thank you so much. I'm so overwhelmed. I always know that Mohan and my ARC people have a very special thing, which probably that is what pushes me forward to do what I do. But I truly have loved this post, and I have just no words to tell you how much I have loved every moment which I've worked with you all. But more importantly, going further, I hats off to my so self-confident, who never let a lacuna appear at any point of time, and the discussion one actually included to be discussed in this wonderful video. I need
Line is going off.
That's true.
Chitra.
Yeah. Can you hear me?
Yeah, now you can.
Can you hear me now?
Yes.
Yeah, so that was so wonderful. The kind of speakers and the kind of videos you all had to show, all very self-confident surgeons. You all really made this webinar a moment, a Friday, a day to remember. And I need to especially thank my ARC team. Believe me, you all need to know, to work with them to understand the kind of dynamism and brilliance they have. If I step aside, all of them can do all of this as wonderfully as you believe that I was trying to do. Very special thanks to Mr. Kripal and the AS team for being our background support in helping us. It goes without saying that Mr. Sunil is just a very special human being who has constantly, sit through these webinars, and is constantly just a word away. Mr. Sunil, I have to say, and is somewhere back there to help us. So I think we need to thank him for the smooth running of the webinar. Our thanks are due to Mr. Sai and Manjula from Numotech for all the mails which come to your inbox. And finally, I need to thank my little young office staff, Mr. Velmurugan, who's always there in the background. And most importantly, our thanks are entered. The video which you saw, they have been a constant support. I have never had to talk to them. I have never had to meet them personally. But they're constantly there behind us to ensure our ARC webinars are well sponsored. And finally, thank you all delegates. I'm sure you would have enjoyed it, and some of you would watch it later on. Thank you, one and all. Thank you very, very much.
Big
Thank
thanks
you,
to
ma'am.
you.
Thank you. Thank you.
Thank you, madam.